again from ARV Centers. We're going to talk today about arthritis of the knee, what you should look out for, and some of the common treatments for knee arthritis. So first of all, unfortunately, knee arthritis tends to sneak up on patients. And what do I mean by that? I can't tell you how many times we've done an evaluation on a patient who we do their x-ray and they're already bone on bone. And for all these years, they never knew they had arthritis. Well, I promise that there's probably been some symptoms from time to time intermittently that comes and goes that was sort of warning that patient that they probably had arthritis and they just didn't know what to look for. So the most common signs and symptoms of knee arthritis are stiffness in the joint, especially in the morning when you first get out of bed, or if you've been sitting for a long period of time. We call this the theater sign. Like if you go to the movie theater, you're sitting for 2 or 3 hours and then you get up and your knee feels a bit stiff. This is that common symptom of knee arthritis. And again, because these symptoms are come and go, a lot of people don't want to tend to address it unless it's constant. Well, I can tell you and I can assure you that once it becomes constant, it might be too late. Too late meaning it's probably already advanced to a point to where we're really going to see some serious signs of osteoarthritis or degeneration on the x-ray. So what to do? Once you start feeling these signs and symptoms, you're having pain with physical activity, you're having pain with bending or stooping, you certainly need to call a physician, get in to see your primary care physician, call the number on your screen or click the link below, schedule a consultation. We'd love to take a look and intervene as early as possible. Everything in health is about prevention. The old saying goes, an ounce of prevention is worth more than a pound of cure, meaning if we can catch the arthritis soon enough, we have a lot more treatment options. Early intervention just with medications, of course, can help with symptoms, but what do we really do to help slow down the deterioration? Number one, it helps to know how bad your arthritis is so that we know what the expectancy and what kind of time we're dealing with. So if it's earlier stages, we can treat with the anti-inflammatory medication, some physical therapy, maybe counsel you on weight loss, what kind of stretches and exercises you need to be doing. Let me tell you, weight is a big deal for the knee joint. So for every 10 pounds a patient is overweight, that's 40 pounds of pressure on the knee. Let me tell you, that's a lot of weight. So very often in San Antonio, of course, we see some big patients. If a patient's 100 pounds overweight, that's 400 pounds on the knee joint. Now you can start to see real quickly why weight's a big deal on the knee joint. So 400 extra pounds on a knee is going to wear that knee joint out a lot faster than it should. So hopefully if we can intervene soon enough, we can counsel the patient on weight loss, on exercises, so that we can get ahead of this arthritis and we're not dealing with the repercussions of severe bone-on-bone arthritis many years down the road. So the next kind of phase of treatment after oral non-steroidal anti-inflammatories and analgesics is physical therapy. Once we can kind of train that physical therapy in a patient, hopefully get them on a long regimen of exercises to do at home. If the pain returns after that, we intervene with a little steroid injection in the joint. Steroids can help reduce inflammation and pain and get patients back in a quick amount of time to doing the things that they like to do. And then the next course is called viscosupplementation or gel injections. These are actually a supplemental type of procedure where we actually increase the volume of the natural hyaluronic acid in a joint. Your synovial fluid, which is the lubricant of the joint, is made by the chondrocyte, which is your cartilage cell. That cartilage cell, as it starts to erode due to the arthritis, we lose the ability to maintain the volume of fluid in the joint. The lack of fluid in the joint is what causes the friction and the wear and tear, and that leads to further arthritis. So if we can intervene and get that gel in the joint, rebuild that volume for a period of time, it's going to help protect the knee. It's going to reduce inflammation, reduce the friction, reduce the wear and tear, get you back to doing the things that you like to do. The great thing about those injections, of course, they're covered under insurance, they're FDA approved, but they're all natural. So it's not a medication. It doesn't have side effects like steroids. It doesn't have side effects like the anti-inflammatories you take orally. It doesn't have side effects like an analgesic. So we can do these viscosupplementation injections very safely. We can do them long-term since we're not worried about long-term side effects. We're not worried about systemic reactions. We can do those treatments for many years. I've seen patients been on them for 20 or 30 years. They were FDA approved back in the mid-90s. So last treatment before we get to joint replacement, of course, we want to leave surgery as a last resort. There's a new treatment called genicular artery embolization. This is a new treatment to treat the excess vascular network and the neurovascular network. So there's little nerve endings along with these blood vessels that infiltrate the joint when the joint starts to deteriorate and break down due to the arthritis change. We're able to see this under x-ray guidance and a little bit of contrast in these vessels. And what we do when we see where exactly this neovascularization is, we can inject some tiny little particles to restrict the blood flow to this network of vessels, takes away the ability for the joint to get inflamed and swollen, and greatly improves patients' activity levels, greatly improves their pain levels. And the nice thing about this treatment, we call it a one and done. It's very rare that we have to repeat this procedure for patients because it can take many, many, many years to redevelop that neurovascular network due to the arthritic change. So of course it depends on how bad the joint is, depends on how severe that arthritis is, but we're typically seeing anywhere from 3 to 7 years of pain relief with patients. And so by this time, we can reassess and determine if maybe the treatment could need to be repeated. And then depending on the patient's age, it can be a great alternative to joint replacement because maybe they feel too old to go through a big knee replacement or a knee operation and go through that recovery time. So this is kind of our typical standard treatment protocols for knee arthritis, from just the oral medications you can do at home, all the way through the minimally invasive type procedures. And of course, joint replacement will be our last option. Joint replacement is obviously relegated to those folks that feel that knee surgery is their only option, but hopefully they've tried all the conservative options first. So hope you learned something today. If you're having knee pain and you're not sure what it is, or you've been previously diagnosed with knee arthritis and you're looking for another opinion or looking for an alternative treatment solution to surgery, call our ARV centers today. We'd love to have you in for a consultation. We look forward to seeing you soon. Take care.